Welcome to Hawaii Matters, a Pacific Media Group community program. I'm your host, Kathy with a K. Our guest is Dr. Jennifer Mbuthia, physician consultant at Hawaii Department of Health Immunization Branch. We're recording in early 2026, and during the holiday season, or actually leading into the holiday season, there was reminders to be prepared for flu season, get your flu shots. And when we got through November, December, there was an increased rate of reports and even hospitalizations as a result of various respiratory illnesses. Dr. Jennifer Mbuthia is kind enough to catch us up on just generally a cold, a flu, or question mark, and when to go to a doctor. So, Doctor, thank you for being here. Dr. Mbuthia, tell us about your specialties as an allergist, immunologist, and your current medical affiliations.
Well, first I want to say thank you so much for inviting me here today. Talking about vaccinations and being able to answer questions is something that I'm very passionate about. I'm a physician, and I'm triple board certified in allergy, immunology, pediatrics, and clinical informatics. So I get to do physician consulting work with the Department of Health, Immunizations branch, and then I also do clinical work. I see patients at both the Queens Medical Center and also Kaiser. I started off doing my residency in pediatrics, actually, at Tripler Army Medical Center. And then after several years as a general pediatrician, I realized that the areas that I was most passionate about really folded well into doing a fellowship in allergy and clinical immunology. And then after I completed that fellowship at Walter Reed in the DC area, I was given one of the most wonderful assignments working with the Vaccine Healthcare Center for the Department of Defense. And that just opened my eyes to not only the value of vaccines, but being able to confidently address questions, concerns, contraindications, complications on pretty much the broadest variety of immunizations that are available.
When is Hawaii's flu season, and where are we now? Like I said, we're in early 2026.
So the flu season in Hawaii actually mirrors the one in the mainland. So we generally start to see influenza cases pop up in usually before Halloween, so mid-October. And then the peak tends to be late January into February. Most often, the case counts will start to decrease around that March timeframe. Sometimes we will see some influenza cases positive in April.
It's the flu season. When it comes to colds, influenza, COVID-19, RSV, it's year-round. It can happen, but as far as the intensity, maybe?
Yeah. So we do know that COVID can happen year-round. So there were cases of COVID during the summer, RSV or respiratory syncytial virus. Although we do see year-round cases, the increase in cases does overlap. It used to be called the flu season, and now a more appropriate term is the respiratory virus season. So there's just a higher volume, higher number of cases of respiratory transmitted viruses. So that can include the common cold, influenza, RSV. But the one that really has gotten the greatest amount of attention because of not only how early it started, but also the volume of cases for this respiratory virus season is influenza.
This is Hawaii Matters. I'm your host, Kathy with a K, and we are talking with Dr. Jennifer W. Mbuthia, allergist, immunologist, and physician consultant at Hawaii Department of Health Immunization Branch. 3 specialties, and thankfully we'll be able to get your insight and your professional opinion on how to combat and be realistic as far as if you have a toddler, or if you yourself are a senior, or if you're a pregnant person, the correct steps. Always consult your personal physician. Doctor, what is the flu versus the common cold?
what we call the common cold can actually be a number of different types of viruses. Probably the most common one would be something called rhinovirus. And some of the key differences between influenza or the flu and just another cold really ties to the symptoms. So the onset of symptoms initially may seem similar with nasal congestion, runny nose, but quite quickly, when you have influenza, your symptoms will progress. So, if you just have the common cold, you might have some nasal congestion, maybe even some sinus tenderness for a few days. So you feel run down. But when you have the flu, within the first day of illness, you will start to really feel very sick. So high fevers are very common with influenza, more widespread symptoms. So cough, sore throat, muscle aches, and just body pain. Some people will say that their joints and their bones hurt, and an intense fatigue. I would equate it to, feeling like you just got hit by a truck, like your whole body hurts. You're very sick compared to someone with that more common cold upper respiratory infection where they don't feel well, but they don't feel as if, their entire body is just overwhelmed with infection.
How can someone minimize their chances of getting the flu or sick in general?
So, and I know some people, they know this, but it's always good to reiterate the best way to prevent severe infection or severe outcomes from influenza is to get your flu shot. Now, ways to just prevent getting an infection in general, we know that when people were wearing masks, social distancing, staying home from school or work when you didn't feel well, that flu case counts actually were lower. And so some of those tools absolutely can be implemented now. Simple things like coughing, in your hands, washing your hands pretty regularly, avoiding large gatherings, especially indoor gatherings where somebody may show up and they're feeling unwell, and next thing you know, they've spread their germs to you. A lot of that will have to do with, what your comfort level is, what your exposure level is. For kids, they're in school, so it's a little hard for younger kids to avoid contacting, the germs of their peers. But then also something to keep in mind is that we've got a lot of families with multiple generations living under the same roof, sharing kitchens, bathrooms. It's common that when some sort of a upper respiratory virus enters a home, that multiple people in that household are going to end up contracting it and also getting sick. So you can't just kick your family out. So what you can do is to maximize your own immune protection by getting vaccinated.
Dr. Mbuthia, can you test for the flu?
Absolutely. Some great things to just be aware of when it comes to flu testing is that there are tests that can be run in a lab. There are some clinical offices that actually have rapid tests in the office, but also you can buy home flu tests. And there are even some tests that are combination of flu plus COVID, but you can go to, any kind of over-the-counter place where you might buy a COVID test, oftentimes in that kind of pharmaceutical healthcare section, and you can buy a home flu kit and test yourself at home. In particular, if, you don't want to necessarily take time out to go to urgent care or it's a weekend and your doctor's office is closed, testing is actually really important when it comes to influenza because for some people who are considered high risk, they might need to receive antiviral treatment, but that antiviral treatment works best when it's given within the first 2 days, ideally, of symptom onset. So if you wait until you've been miserable and sick for 4 and 5 days, and you're one of those high-risk individuals, while you might still receive the antiviral medication, it's not going to be as effective. So early testing and diagnosis, early treatment, especially for high-risk individuals, all of those tie into why being able to test for the flu is really important.
And that's a good reminder for myself. Anytime I feel less than 100%, I get a voice memo or I open my calendar and I'm like, tickle in my throat, and I just save it so I can kind of backdate how I should be at 100 all the time. This is Hawaii Matters. I'm your host, Kathy with a K, and we're talking with Dr. Jennifer Mbuthia, a physician consultant at Hawaii Department of Health Immunization Branch, and getting a refresher, or maybe it's an introduction for you about respiratory illnesses, primarily the flu, because we are still in flu season, the traits of a common cold, also reminders about COVID and RSV. Dr. Mbuthia, when should someone make an appointment to see their doctor if they're feeling unwell, and especially if they think, WebMD can help me, it'll be fine? But give your professional insights on this, please.
So right now, I would recommend if you feel unwell, so cough, nasal congestion, sore throat, and in particular also having a fever, whether you've had a known flu exposure or not, I do recommend getting tested. Also, if you have any other kind of comorbid or risk factors, you should probably get seen and evaluated. The thing about influenza is that there are kind of a variety of different risk categories. The far ends of age, so very young children, especially those age 4 and younger. Now, one of the interesting things about that age group and the flu, especially this season, kids may show more GI symptoms, so vomiting, diarrhea, nausea, in addition to the fever. If a child that young is unwell, they should be evaluated. People age 65 and older should also seek care because their age is a risk factor, but also they probably have medical conditions that also increase the risk of a severe outcome. Anybody who is immunocompromised or immunosuppressed, if you're not feeling well, you should contact your doctor. Another category that sometimes gets forgotten are pregnant patients. Pregnancy in and of itself, the immune system kind of softens its response because you've got a parasite growing. And that's the way I vision it. But also as women become further along in their pregnancy, you've got that growth inside, so it can limit your lung capacity. Anybody who's had, who's gone through a full-term pregnancy will probably report some shortness of breath. So now on top of that, if you get the influenza, the outcomes can be more significant, more severe. So those are kind of the categories of patients who, if you feel unwell, or if you took a home test and you did test positive for flu, you should be contacting your primary care provider and discuss either treatment options, or depending on your symptoms, you may need to actually come in to be seen or go to an urgent care for a broader variety of treatments. So if you have underlying respiratory disease like asthma or COPD, you may need to have some additional medications prescribed, again, to try to maximize you recovering quickly, minimize you needing to be hospitalized, but also to be able to do a better assessment on how sick you are.
Dr. Mbuthia, when you are talking about these different respiratory illnesses, and actually to go back, GI is in reference to
gastrointestinal symptoms. So that's going to be nausea, vomiting, and diarrhea.
Yeah. You probably, all the acronyms you are so familiar with, and I'm just like, I've heard that from a long time ago, which is good because I haven't had to deal with it. So thank you for that reminder. Also, how people will try to self-diagnose, ask your PCP. Also, be an advocate. Don't be afraid of if there are recurring symptoms, and if something over the counter or whatever your doctor might be prescribing, get a second opinion, or what is another way to just ensure that the patient is fully telling their doctor all the symptoms and all the medications that they've been taking. Can you just also remind patients, like, be a good patient with your doctor, listen to what your doctor's saying, be accurate with your personal notes.
Yeah, I mean, all the points that you brought up, your doctor's going to ask you about your medical symptoms, like fever, aches, pains, cough, sore throat. It is important that all of the medications that you're taking, including any over-the-counter medications or supplements. If you have a primary care doctor, they should have a record of all your prescribed medications. But there are people who don't have a primary care doctor. In those instances, it is important that you have an accurate list of what medications you're currently taking or supposed to be taking. If you can't remember all the names, I have had patients come in with a gallon Ziploc bag with all their pill
That's
bottles.
Great. That's
They
good.
can't remember all the different inhalers that they're on. And so if you just bring it in, then we can go through it and sort through it. And that's also important because if I'm going to prescribe somebody an additional medication, it's important to be able to cross-check and verify if there's any medication interactions. As physicians, do no harm is our first kind of mantra. And so I want to make sure that what I'm prescribing is not going to interfere or interact with an existing medication, either by causing side effects or interfering with the effectiveness of that medication.
Dr. Mbuthia, once someone recovers from the flu, can you get it again within days or weeks?
Yes. So the short answer is yes. And the reason why is because there's not just one flu virus. In fact, in the vaccine, it's not just one flu virus. What circulates around the globe in seasonal patterns, usually there will be one or two strains of influenza type A, and then also one strain of influenza type B. When you get your flu shot, because hopefully after this, if you haven't gotten it already, you will get your flu shot. It's what we call a trivalent vaccine. So there are two types of flu A and one type of flu B contained in it. So currently, the strain of flu that we have just seen dominate this respiratory virus season is the H3N2 strain of influenza type A. So you can catch that, but if you haven't had your flu shot, you may catch influenza B, the strain that is also circulating. It's just not the dominant strain. You can catch another strain of influenza within the same season. That's why even if you had the flu, let's say in December, you tested flu positive, your doctor probably should have, if they did not, recommend that you still get the flu shot for the added protection because there's more than one strain that's circulating.
What is a misconception to having a cold or flu? A lot of folks are like, just it's a mess, and it's like, it's fine. I'm fine. And there's a runny nose or something. But yeah, as we get older, we feel we should or we can power through.
Probably one of the most common misconceptions that I see or hear either in a clinical setting or even just in a casual social setting is, especially this time of year, people will try to say that their runny nose and cough is just their allergies. And as an allergist, something that I know is that right now it's January.
Okay.
Nothing is pollinating. You're not going to have seasonal allergies right now. So when you have cough, runny nose in January and December, unless you just got a new kitten or a puppy and just had that new, exposure to animal dander, it's probably a respiratory virus of some sort. But I've seen a lot of people, they try to minimize their symptoms, which then leads to them potentially spreading infection to other people. And again, there's more than just influenza that circulates. As an allergist, that's probably the number one thing that I see people minimize. And then I also see people assume that the flu is just like a common cold and that it's not a big deal. In my clinical career, which again included general pediatrics, both inpatient and outpatient, some of the sickest children that I saw had influenza. And There's again, winter time was the busiest time for our inpatient peds wards when I did general pediatrics. There's, again, other viruses like RSV or respiratory syncytial virus. I've seen really sick people with things like adenovirus, but time and time again, I would walk into a clinical exam room and I would predict what I thought this was. Then, we do the testing and then the testing would come back. And if a kid just looks like a wet rag, they look drained, they look really unwell, and they have a fever, those kids almost always ended up being flu positive. Mm-hmm. I want people to take seriously not only their own health, but also their family members. The flu can have other, kind of consequences. This virus can cause an infection of the heart muscle. You can have an inflammation in the brain. So some people can have neurologic complications from just getting the flu. One of the things that I love is medical history. I just really enjoy kind of reviewing medical history. Mm-hmm. And when you look back at how a virus like influenza, 100 years ago, more than 100 years ago, how devastating it was, how it can impact not only an entire household, but entire communities. And again, especially the most vulnerable people. I feel like I take it very seriously and I advocate not only for my immediate family, but my extended family and friends to just take the flu season very seriously and maximize your protection by getting an influenza vaccine.
You just heard from Dr. Jennifer Mbuthia, physician consultant at Hawai'i Department of Health Immunization Branch. My name's Kathy with a K. I'm your host, and this is Hawaii Matters, and we're talking about primarily flu. We are in the season, but also refreshing you about the cold, RSV, respiratory illnesses, COVID-19. While we're outside of the pandemic, it did end 2023, 2024. It is still active. You can still be tested positive for that. Dr. Mbuthia, you encourage folks to get flu shots. What about those who are without health coverage? How would you recommend themselves to protect themselves and their family?
So that's an excellent question. So even if people are uninsured or underinsured, there are still ways for them to get vaccinated against the flu. There is a program, a federally funded program called Vaccines for Children. So 18 years and younger, they can receive federally funded immunizations, not just the flu shot, but any of the vaccines that are on the childhood immunization schedule or recommended for children. The federal government funds those. You just need to go to a facility that receives the VFC funded vaccination. So for 18 and younger, VFC would cover. So that would be a no-cost vaccination. For adults age 19 and above, there is no equivalent of VFC. However, there are community health centers and federally qualified health centers. They are able to provide not just vaccinations, but care to people who are uninsured or underinsured. So that's another opportunity that you can take advantage of in order to get a no-cost or a low-cost flu shot this season.
Dr. Mbuthia, when is it an allergy, a cold, the flu? I think asthma would fall under allergy if it progresses, right? Or see, I'm just like, as if I'm WebMD, how dare you? Or COVID. Are those the general categories, or is it actually streamlined within that?
Oftentimes, as an allergist immunologist, allergies and asthma are kind of grouped together. But I do want to point out the most common trigger for an asthma exacerbation is an upper respiratory viral infection. Oh. So that's the number one trigger across all different severities of asthma. So asthma is a chronic underlying condition, whereas like seasonal allergies, influenza, COVID, those are, kind of things that can happen to your body. Allergies, seasonal allergies, well, they have to follow the pollen seasons. So we've got grass pollen season, tree pollen season, and weed pollen season. So seasonal allergies are going to follow a pattern of when there's pollen in the air. Mm-hmm. So one of the things is the time of year that it happens is a big clue. Oh, it's allergies. Things that will not happen if you have allergies. Allergies will not give you fever and general muscle aches and pain. Now, can allergies be a setup for something like an ear infection or sinus infection? Yes, they can. But also a thing about seasonal allergies is that you have to be on the planet existing through multiple seasons in order to become allergic to the circulating pollens. So we don't often see seasonal allergies in kids who are less than 4 or 5 years old. So if you have a 12-month-old who now has nasal congestion, it's not seasonal allergies. In addition, allergies are kind of something that tends to happen during childhood and early adulthood. So if you've never had an issue with allergies in your teens, 20s, and 30s, and now here you are, 50 years old, and you're getting nasal congestion, it's not from seasonal allergies. Now, there are some things that happen as we age that can make people more prone to getting chronic nasal congestion or chronic runny nose. That's not an infection. It's just it chronically happens as we age. But if it just started 2 days ago and you had nothing prior to that, number one on the list is going to be some sort of an upper respiratory infection. Then, we've just talked about the common cold versus influenza. Influenza and COVID do have a lot of overlapping symptoms. Right now, there's not a lot of circulating COVID, but if you were to go to a doctor's office or an urgent care, they're going to test you for both because treatment options are different for both. One of the key differences in terms of just symptoms is that with COVID, a lot of people may remember that patients who had COVID would lose their sense of smell, something medically called anosmia. You cannot smell or taste. That is not something that will commonly happen with influenza. So if you have a loss of taste or smell, it's probably COVID versus influenza. But again, this is why I'm glad that now there's over-the-counter testing for both. There's combination tests that are available. And if you were to go to your doctor's office, especially this time of year, if they don't have the ability to do in-clinic testing, they can send out rapid tests so that by the end of the day, you'll know what the diagnosis is, and then they can provide additional steps or prescriptions if indicated for treatment.
The activity on Hawai'i Island with the volcano, with primarily, I know like the neighbors on Hawai'i Island, they're getting the effects of all that smoke and ash in the air. And sometimes the winds will just carry it over the rest of the island chain. And here on Oahu, are we also getting the effects? Would that also be not allergy season, but VOG?
Another common thing that people will either report or will address concerns about to me clinically is VOG. You cannot be allergic to VOG, but VOG is a form of pollution. So it can irritate both your nasal mucosa, so the inside of your nose. It can irritate your eyes. People with underlying respiratory conditions, it might irritate it, but it's a type of pollution. Can people be more sensitive than others to VOG? Absolutely. Mm. Their symptoms, again, will be a little bit more mild. Usually they'll have eye and nose symptoms. Again, they're not going to have fever, and their symptoms will correlate with the VOG count. So just like there's some cities where they'll report the pollution, low, medium, high. Similarly here in Hawaii, it's not that hard to find out if the VOG is elevated. People who are obviously closer to where there's volcanic activity, they may report more symptoms. This is something that they recurrently have, and most often they are familiar with those symptoms. So if somebody says, this feels different, or again, if they just overall feel unwell or having fevers, those would be reasons. And, there's really no harm in just checking to make sure that it isn't something infectious or something more serious than just the usual, your usual nasal symptoms or eye symptoms from VOG.
What is one general health rule that can help us heal in all seasons, or heal ourselves, keep healthier so we can just stick with our annual wellness check that we have with our doctors, because when we're healthy, we're like, oh, I don't have time, but I guess I'll keep my appointment, versus just visiting when you're not feeling great. If everyone in the world started here.
Yeah. So at different ages and phases of life, there are different things that, a healthcare visit is going to either recommend or screen for. So I think that staying on top of annual wellness visits throughout the spectrum of your life is important. Go to see your primary care provider or go to urgent care just for sick visits. That's what they will address. When you go to your doctor for an annual wellness visit, they're now going to verify, make sure that you're current on all of your age-appropriate immunizations. They're going to double check and verify, when was the last time that we checked your cholesterol or your hemoglobin A1C? Are you current on all of the recommended cancer screenings like a colonoscopy or a mammogram? And then there may also be some additional risk-taking behaviors that they can discuss with you and just provide to you medical recommendations based on what the current medical evidence and science is saying, whether that is that you do, you ride a motorcycle, or maybe you smoke or you vape, or even consuming alcohol. So those are the things that your healthcare provider can talk to you about in a wellness visit that is not going to be, heavily mentioned or brought up during an acute visit, because an acute visit, they're going to talk about the acute issue, your sprained ankle, your cough, your sore throat. They're not also going to pivot to talk to you about, let's talk about smoking cessation, and maybe we need to make adjustments on your blood pressure medications. Those kinds of discussions will happen. And then during a wellness visit. And then the other thing too is with those annual wellness visits, you get to know your provider. They get to know you. It just forms that doctor-patient relationship or that healthcare provider-patient relationship that will further build trust. So that way, down the road, if they do recommend something different, or they highly recommend, a vaccination based on your health history, you're more likely to put weight in that, because now you've built a foundation of trust.
Thank you, Dr. Jennifer Mbuthia and Hawaii Department of Health Immunization Branch. Is there a website very broadly for people to just get information on their own? Official place to start?
Yeah, so I recommend for, all sorts of different healthcare related issues here in the state of Hawaii, going to the Department of Health, the Hawaii State Department of Health's webpage. There's search buttons. You can look up a variety of different issues, from water safety and issues that are going on there to what the current status is of certain circulating diseases. So your Department of Health is your local webpage to find out health-related information.
I'll include the link in the podcast show notes. To share or replay this episode, search Hawaii Matters where you stream podcasts. For Pacific Media Group, I'm Kathy with a K. Mahalo.